You guys got your white balance? All right, don't have these nice looking people look green on TV. Good afternoon, guys. We're so happy to invite you here in City Hall for another great announcement. You know, this is another blessed day that God has provided us with, and I'm so happy to make these great announcements. You know, City Council has come together after some large deliberations about the medical debt and the medical debt that burdens residents in this great city of Flint. You know, Gandhi said, the worst form of violence is poverty. And we want to make sure that we provide a level of relief for our residents here in the city of Flint. Understanding that medical debt has been a heavy burden here in the city of Flint, we've had the opportunity to partner with other organizations across the state of Michigan. I want to thank Pastor Monica Valeria. I want to thank Lisa, and also all the other people who have lobbied for this. I want to give a big thanks to City Council and City Council members for being able to pass this and understanding that this is going to provide a level of relief for residents in this great city. Today I have a number of people behind me today to celebrate this opportunity for residents, but also I want residents to have a great understanding on how we can dispense this wonderful blessing, this benefit that's going to help families that has been burdened with medical debt. The quality of life has been reduced in many cases when you are not well. But when you're brought back to full health, many times you have a level of debt, and that's also burdensome. But now we have opportunity to relieve some of these debts. Partnering with our dollars from an American Rescue Plan, we've been able to put these dollars into action for residents. Here with me today is our City Council Vice President, also our City Council Treasurer, Candace Mashat, Vice President, Judy Priestley, our Treasurer, are here with me today to talk about the level of benefit that City Council saw in this program that was brought forth. Vice President Mashat.
Thank you. I am honored to be here today to say that this was a community-led effort, and we were just here to support. Pastor Monica and Lisa, they brought this to us and said, hey, this could help save a lot of lives. And when we say save a lot of lives, we understand the anxiety and the mental anguish that comes with being in debt. We understand what it means financially when you're in debt and how it, like the mayor said, it contributes to poverty. We've all been in a situation where we've had to go to the hospital, and after we've gotten out of the hospital, you have that other bill that comes that you're not quite prepared for. We've all been in a situation where we've been hit with medical debt ourselves. And so this only made sense to do something that we could make sure that residents felt some relief in their pockets. So I'm honored to be here today. Thank you again to Pastor Monica. Thank you to Lisa and everyone who contributed to this effort. There were so many other community members who are also a part of this, so thank you to them as well.
There are many nuts and bolts to this program, but definitely we want to make sure that you have an opportunity to understand how this program is working and how it's going to be implemented. So I bring to the microphone now, Lisa.
Good afternoon. My name is Lisa Passberg, and I am a proud Flint resident. According to the KFF Peterson Health System Tracker, as of February 2024, 14 million Americans owed over $1,000 in medical debt. 3 million owed at least $10,000 in medical debt. Medical debt accounts for 40% of bankruptcies in this country, and it's not limited to any class or group of people. Anyone can end up in a situation where medical debt becomes unmanageable. Medical debt is not the result of poor planning or financial incompetence. It most often results from bad luck, health emergencies, unexpected charges, denied claims, huge cost discrepancies between facilities, chronic conditions, and COBRA premiums. In my own family recently, I had someone laid off, and because in our country so much of us have our health insurance tied to employment, she lost her insurance for herself and 2 children. The COBRA premiums to keep that insurance going would be $1,234 a month. The unemployment cap in the state where they live is $275 a week. If she paid the COBRA premium, she would be left with $34 a month to cover housing, utilities, food, and all of the other necessities of life. We're all painfully aware that most Americans are living paycheck to paycheck, and while wages have improved, they have not kept up with inflation. In 2023, 68% of Americans reported that they would not be able to cover living expenses for 1 month if they lost their job. While I, as a Flint resident, will not benefit directly from this program, I fully support how this will benefit so many of my friends and neighbors. While the recent decision of the Biden administration to remove medical debt from credit reports will assist so many Americans, medical debt will continue to be a leading cause of bankruptcies, financial hardship such as inadequate funds for food, medicine, and other necessities, homelessness, delayed care, poorer health outcomes, and the mental and emotional stress that comes from being overwhelmed by debt. Removing this burden from so many of our fellow residents will allow them the dignity of rebuilding their lives and their credit, and will uplift our community as a whole. I'm really grateful to the City of Flint and the Flint City Council for bringing this fantastic program to our community. Thank you.
In the City of Flint, we have a mantra. We call it prayer, planning, and partnership. We pray over every decision. We plan and we look for our partners. Members of the faith community is behind me as well today. Dr. Daniel Moore and Pastor Monica Valeria is here today to be able to speak on behalf of the faith community and how they brought this forth to us and to our attention to be a benefit to the great residents of this great community. Pastor Monica.
Thank you, Mayor. On Wednesday, the City Council made history by unanimously passing the medical debt relief proposal, taking a bold and transformative step to erase millions in medical debt for thousands of Flint residents. And this decision reflects a commitment to lifting the financial burdens that have weighed down our community for far too long. Medical debt is a significant burden on our families, often leading to bankruptcy, credit damage, delays in seeking essential medical care, which ultimately leads to increased emergency care and higher cost. The Undue medical debt program aims to eliminate medical debt for lower income and middle class families at 400% the federal poverty level, or a medical bill that's 5% of a total income. These debts are at least 1 year old and have already been deemed uncollectible. Instead of sending debt to a debt collector, Undue Medical is able to purchase the debt and eliminate it. This will have a real and lasting impact on the financial stability of Flint families while increasing access to health care. The City of Flint now joins Wayne County, Oakland County, Ingham County, and Kalamazoo County in partnership with Undue Medical to eliminate medical debt. The state of Michigan has already committed $4.5 million to this initiative. With the City of Flint's $50,000 contribution, an investment in our own community, which guarantees the city's eligibility to leverage the state funds available, this program looks to partner with our local hospitals to eliminate about $32 million in medical debt for about 10,000 to 12,000 Flint residents. This program offers an equitable and efficient approach with no application process required. The partnership with Undue Medical ensures that funds will be direct and immediate relief for Flint residents. Since 2014, Undue Medical has worked with over 305 medical providers to eliminate over $14 billion in medical debt for 9.85 million people nationally. Michigan United and our coalition of community partners are excited to continue to work with the City of Flint, all of our council members, our wonderful community, and Undue Medical on this initiative. Together, we are creating a healthier, more equitable, and prosperous community.
Now, with that said, this is the first city in Genesee County to be able to engage this, and we want to make sure that we are the starting block for other communities throughout Genesee County and also the state of Michigan. We often said that Flint inspires a nation. We continue to move doing things for the very first time to be able to enhance the quality of life for residents in this community. But definitely we have to work together with a level of vision and opportunity will present itself to be able to enhance our lives. Definitely here today, we have shown a level of prayer, planning, and partnership and how that's going to benefit residents of this great city. With that, I offer the microphone to Pastor Dr. Daniel Moore for any comments. He agrees with everything I just said. So definitely with that, we'll take a few questions and then some one-on-ones. Yes, Zane?
So how will people be selected? What criteria do they need to meet? And if there's no application process, how are they chosen?
The eligibility is the 400% of the federal poverty level or a bill that's 5% of the total income. Undue medical debt will contract with the City of Flint and do contracts with medical providers. In this case, we're really looking to the hospitals. Undue medical debt buys debt portfolios in bulk. They're large portfolios. Anyone within the portfolio that meets that criteria, if they are a City of Flint resident, it'll be City of Flint and the state of Michigan dollars. If there is a non-City of Flint resident captured in the large portfolio, Undue medical debt is dedicated and committed to using their own philanthropic dollars to meet that need so that all debt that is available for purchase and elimination happens.
People that are maybe at home watching this and kind of thinking about the numbers, 50,000, it was 4.5 million, correct, from the
Yep.
state. They're thinking, how is that going to erase $32 million? Can you explain that too?
Medical debt is very cheap to buy. And on average, for every $1 invested, Undue Medical is able to eliminate $100 in debt.
Obviously, we're working through the hospitals and the other healthcare providers, but if an individual has questions, to understand how this may affect them, even though they can't apply, is there anywhere they can go with Michigan United or with Undue, just to get an idea of what this could mean for them?
Absolutely. I definitely encourage residents to look at Undue Medical's website, undumedical.org. I'm sure Michigan United, we will be putting forward some information on our website, and we are blessed to partner with the City of Flint as well. We want, all of us want this information out there. It's important program for our city. And we hope to also leverage this, at least Michigan United, to address some other policy issues down the road as to why we have such high healthcare costs to begin with.
And I think the city might also have links to that.
Yep, we'll be putting some information on our resource dashboard, resource connection to where residents can go and get the help that they need in many different aspects. And this will be on our dashboard. We're working to put this up on our webpage and also make sure you can call the City of Flint to be able to just ask the questions, to be able to connect to the resource in which you need to be able to enhance the quality of life for you and your family in this great city.
If you are selected to have your medical debt eliminated, how is that patient or that person identified?
Say it one more time, Zane.
If you are selected to, be someone whose medical debt is eliminated or raised, how are you notified about that?
Undue Medical will partner with the City of Flint to hold additional media and press. A letter will be prepared to notify all residents whose debt has been eliminated in this program, and we'll definitely have some great outreach because that will be another huge moment of celebration. And we also want residents to know the letter's true and that we can celebrate. It's not something that's fake or made up. That it is a very real thing that happened, and that'll be a wonderful time of celebration for our community.
And we'll be holding more workshops using our city facilities, especially the Clio Road, Pearson Road, and the Harwood Plaza, using that facility to be able to walk in and be able to talk with people as a resource coordinator activity, making sure we can connect people to the activities in which was birthed out of great partnerships. American Rescue Plan dollars has helped many people in many aspects, and the dollars that we use from that program has unlocked the door to be able to unleash additional dollars, millions of dollars for the benefit of those individuals who had this medical debt that has burdened families for years. All right, we can break away from one-on-ones, and thank you guys for braving the weather and getting out here. Thank you.
Thank you, Mayor.